Let's get oral. Let's get oral.
Woo! And here we are at the Totality of Care at LMU in Knoxville, Tennessee. And right now we're sitting down with Debbie Durako. Is that how you say it?
Durako.
Durako.
You were very close.
Who is bringing awareness around StellaLife oral care products. So tell us about StellaLife, but actually I kind of want to hear first, what was your journey to StellaLife and how did you get here at this conference for oral systemic health?
Oh, it's my pleasure to be here. My journey is very interesting. I started out as a clinical dental assistant. Didn't really know what I wanted to be in high school. And I had to have speech class, and I didn't know what I was going to talk about. And in my senior year in speech class, I had worn braces. I thought, that'll be easy. I'll just talk about my teeth. And that's how it all began. I did
so
some
funny.
research. I got my orthodontist to give me my models, and I talked about teeth. And during that research, I got fascinated with everything about teeth. So my journey started as a chairside dental assistant. I went to running multi-million-dollar practices. I have been a consultant to offices to share my knowledge of what I was able to do over the years, working together with others. I've also taught postgraduate hygiene training courses, and that was such a pleasure to be able to really dive deeper into biology and understand where we could do better. So that's my background, and how I found StellaLife was that they were early on in their journey, and I was looking for more natural products for a dental office I had been communicating with.
Okay, wait,
And
I'm going to
just-
stop you there. Why were you looking for more natural products?
The doctor was looking at his patients and saying, you know, I've got patients who sometimes their gums turn bright red when we use certain things on them.
Okay.
I've got patients who we've done certain types of treatments on that seem to have chronic inflammation, and I'm kind of interested in if there's something we're using. So he started to research and say, you know what, I wonder if there's more things out there that I'm just not aware of because school never taught me that.
Yeah.
I'm doing what school taught me. So in that journey, we were able to do a little research, and that's how we found StellaLife. The clinical case studies that were presented 7 years ago, for someone like me who've seen a lot in dentistry, I was incredibly impressed with the ability for it to not only rapidly heal tissues like I'd never seen before, but their mission and their vision was really important and really aligned with what I felt we could do better in dentistry. So that's how I got into it. That's how I got started.
That's
Incredible. I love that. And I love that the dentist was so curious to really think deeply about what he was using and how it could possibly contribute. I don't think people ask enough.
It's very true.
I think we have a limited amount of hygiene products that are kind of based on this, historic premise of removing microbes and strengthening enamel, which there's so much more going on there. So tell us about StellaLife and what makes it such a meaningful and different product.
It would be my pleasure to do that. StellaLife's mission and vision was to improve people's lives by accelerating healing, relieving pain, doing it as natural as possible, and more importantly, reducing the use of opioids in dentistry.
Yeah,
and that's
nice.
where it all began. But along that journey, we discovered through science we could do so much more than that. So StellaLife was built around that idea that we really could make a difference in pain management. When you look at some of the case studies, university-level published studies on this product, one of the most impressive things is that we are using plants and minerals and being able to synergistically combine over 16 very well-researched, very well-documented types of plants and minerals that have been used in plastic surgery even for years before dentistry even looked at it, like arnica, for instance.
Sure.
We were able to find a formulation. It took over 17 years to do it,
Wow.
but a formulation that could actually interrupt inflammation, but not take it all away, because we need some of that for healing.
Yep.
True.
We are also able to be an antimicrobial, bacterial static, but not affect all commensal bacteria,
Right.
and disrupt biofilm, and we don't affect nitric oxide.
Excellent.
So we have a very unique patented product now that can do so many things for these patients. And having access to it is really important as well. So that's how our journey began. But here's where we're at today with these amazing case studies, amazing conversations with these doctors here today that are using our product and the difference it's made in some of their patients' lives.
I bet. I mean, we need a lot more solutions for these patients. We just don't, we're here at the frontier.
Yes, we are.
Really kind of in the kitchen sink trying to figure this out together. So I really appreciate the innovation here. Can you tell us about some of the ingredients that really have been provocative for you?
Yeah, I think what's interesting is when you look at the list, there's over 16 of them. I always jokingly say this, I can't really pronounce all of them because they're quite interesting. But I think the one or two that stand out for most people are arnica, because that's something we've heard a lot about.
Yes.
Arnica's been used in plastic surgery, as I mentioned earlier, to control swelling and bruising after facelifts.
Yeah.
So they would either ingest it or a combination of topical application and ingesting it. We know that works for controlling that bruising and inflammation. I also think that it's also very important is A. indica. A. indica has so much incredibly interesting research on how it can actually protect cells. And it's really, when you dive deeper into that particular type of ingredient, we're discovering more and more about how important it really is as a protective device. Knowing that we can disrupt biofilm and break through that force field is incredible with a topical application.
Right.
Whereas before we understood that you had to use some mechanism of action like a piezo technology.
Sure.
To be able to do that. But if our patients could take something home and do this every day, we can kill FN for over 12 hours. We can kill P. gingivalis for 96 hours. And imagine what your patients would look like if they were using that at home every day without harming all the good stuff.
I mean, it's interesting that you're lowering F-nuke, which is a bridge bacteria for the nitrite reducers, but yet you're not affecting nitric oxide. So that's an interesting, I would like to follow that up as a research nerd.
Yep.
What is
We would
happening
love that. We always say the good, the bad, and the ugly.
Yeah.
You know, this is the way you learn. And these research scientists who have been studying our products have been really intrigued with, particularly with our peri-implantitis issues that are happening. We've actually come out recently with a lot of research behind not just topicals like we've had with StellaLife Vago Oral Care, but we're going more systemic now. So one of the things that I think is very interesting is that we're seeing implant failure at the highest rate we've ever had.
Yeah, of course.
And we're drawing it back to pathogens, but there's another element here. And we talked a little bit about it yesterday.
Tell me it's inflammation.
It's inflammation, but it's
Ding, ding,
also vitamin D deficiency is dramatic in our community. In the U.S., the last statistics were well over 70% of the population is deficient in vitamin D to the point where it's not helping us with our immune systems, which is what is so important.
Right.
So what we did was we did some research called the PAUSE study. We actually have that posted on our website. Very intriguing how a group of patients were studied, multiple patients, on implant failure of bone integrating. And what they all had in common for the majority was vitamin D deficiency. So the other thing I think we're on the forefront here with this group, and especially with innovation, is that I would like to suggest that before we ever implant, we need to do two very important things. We need to test that saliva.
Yes.
See what environment we are placing an implant into.
Yep.
And number two, test the vitamin D. Because if you go into an environment that cannot produce enough of the activity to draw that calcium out of the bloodstream, to repair that site, you're going to see implants not integrate the way they need to. So in that study, when they tested these patients that were failing, their level of vitamin D was literally 10 to 30 rather than it being 50, which would be the minimum you want. So we created a product that actually is a nutritional support system that boosts that D up and gets them where they need to be prior to surgery and continue postoperatively. It's a loading dose. So it has things like D3 and K2 and E.
Yes.
It has A and C, all the B vitamins, calcium, magnesium, selenium, all of those things, zinc. We're so deficient as a community in so many of those things. So we rise it up, get it up there, do the implant, and keep them on it for a little while. After that, they can use a half dose ratio of our product to just as a great opportunity to give you the nutritional support you need that you may not be getting from your food sources.
Right.
So very innovative and thinking ahead of the game here and what we can do to be more preventive.
That's fantastic. So with peri-implantitis, once it develops, do you have any products that can get the actives down into the pocket that is now compromised?
Yeah, we have two things that have been working very well for peri-implantitis, our rinse and gel combination. Our recovery kit has three things. It's a rinse, a spray, and a gel. The spray is delivered sublingually, so it will enter the bloodstream in small increments.
Sure.
And the gel is topical, so it helps soothe and feels great on the tissue. So cold sores, canker sores, but in reference to peri-implantitis, I think there's some other things that we are really interested in learning more of. There's a brilliant research scientist, Georgios Koutsakis, and he's at Rutgers. Oh, yay, because I love what he's doing.
Yes.
And he just posted an amazing picture on social media of an implant surface with biofilm and tiny little specks all around that demonstrating how the titanium was flaking off,
Yes.
causing this irritation and peri-implantitis. Yeah. So what we've been working on is let's understand the implant surface as well. Right. Even biologically, we might have pathogens that are causing this, but we also know a contributing factor to this is that flaking of the titanium on the implant into the tissue like splinters, causing this irritation. So we want to understand, and there is ongoing research
Yes.
on implant surfaces and what are we using chemically around those that could actually corrode them.
Yes.
And that's very interesting science that's being done right now.
I love that you're going down this road. Dr. Purnima Kumar just published a paper that we reviewed for them on LinkedIn. She basically had evaluated 3 different types of implant and biofilm formation, but she found no difference when there was no peri-implantitis present because you don't have that deep pocket and the exposure of the material, which I thought was an interesting nuance to that story. Not until you get some level of inflammation and disease do you start seeing the differentiation of biofilm per different types of product.
Yes.
So there's a lot to that story that needs to be unearthed.
I agree. We need to understand better.
Right.
And I think this is what researchers are doing. They're sharing their data, they're sharing their studies. We're seeing some really fascinating things in regards to prevention, because that's the ultimate goal.
Right.
You want your patients to have these surgeries to give them form and function back and beauty in some cases, but you want it to last.
Yes,
and
please. That's a lot of money to
it's
throw
a big
down.
investment.
Yes.
It's a big investment. And the thing we can do at StellaLife is we want to help those patients have that potential longevity of restorations, not just surgical restorations, but a lot of the beautiful work that we're doing, veneers and crowns and bridges.
Yes.
And, you know, when you control strep mutans, which we can do, we can manage a lot of these patients a lot differently. And again, going back to not harming the good stuff is as valid.
Right.
So
Yes.
we want to look at the big picture, surgeries, long-term care for patients who have these beautiful restorations, less decay issues in our children particularly. And something else we just branched out into systemically this last year was we actually have also joined forces to create an oral and gut probiotic
Very
kit.
nice. Okay.
I love
And
it.
it's geared towards, again, our concept was topical, and now we're systemic, and combining those forces together. The particular strains that we chose were very important because not only is it a spore probiotic, we also added pre and post. So they're getting the best of all of those worlds, and particularly the types of strains were patented to really focus attention on funguses, strep mutans, inhibiting the activation of perio-pathogens, being able to reduce staining. There's so much more to thinking about this big picture. So we've designed this to be an oral and gut. So they work on both simultaneously. Oral with a lozenge that tastes actually good, and it melts
important.
slowly. It is important. Vegetarian capsule on our spore gut bacteria so that it's easier for the stomach to process. And we chose spore because we knew that it would last longer in the stomach acids.
Right, of course. That's the whole goal, is to get it to the intestinal.
Exactly. So we understood that. And so that was another mission and vision for us, is to think bigger than just topical. Now let's go and really go root cause.
Yeah.
And so StellaLife has been developing products, and we continue to do this and expand those products to be able to think of the bigger picture and long-term health.
That's fantastic. I'm excited. You're doing a big lift with all of the research. I really appreciate all of the research here and the continued innovation. Do you think you'll get to the point where you have interpocket therapies that will kind of insert into the area to get a direct application? Or
It's certainly something we'll consider. Our gel has been phenomenal in periotherapy because the texture of the gel allows it to seep into the sulcus. So our perio protocol is for them to rinse and then to use our gel on the margins around tissues that surround the buccal and the facial, but more importantly, interproximally where that
Yes.
non-keratinized tissue is, and it seeps down. And one of the beauties is that it also decreases the inflammatory reaction to the trauma of the scaling and root planing. So we're managing pain a little differently for these patients, but at the same time, we're rapidly healing those microscopic wounds and killing the bacteria. So it acts like that.
Right.
But I think we can probably evolve even further into that concept and being able to have maybe something that would last even longer than the gel does in that site.
Sometimes I think a device going in that dissolves is really meaningful for those patients that are hard to treat, only because we have that constant exodus of crevicular fluid. So it's a hard one to manage sometimes. Yeah.
It is. And what's really also interesting is that when we did some initial pilot studies on other types of conditions like cold sores and canker sores, it was fascinating that one of the pilot studies demonstrated that when we had a group that was treated with lasers, particularly with canker sores, we had a group with magic mouth rinse, which is a combination therapy that's compounded. And we had a group that just used the StellaLife gel. And when that pilot study was completed, the group with laser and with magic mouth rinse took about 10 to 14 days for complete wound healing.
Right.
StellaLife, 2 to 3 days.
Wow.
Holy cow.
So why?
That's beautiful. I love
The
that.
question is why, though? So we believe it's because not only are you cleaning the wound up by being an antimicrobial, decreasing the inflammatory reaction of the wound, but again, you're accelerating fibroblastic activity and moving those fibroblasts so fast that they close the wound in record time. But we're also a big advocate of lasers. So if you like to use a laser to treat, you absolutely should. But use our gel after and send them home with the gel, and it's even faster.
What color laser are we talking?
It just depends on what the treatment modality is. I don't have a huge background in lasers, but I can tell you I have some favorites out there. But I think with photonic energy that they're trying to, accomplish wound debridement with the laser, being able to clean it up.
Right, so blue light therapy typically is the antimicrobial, and then we have the red light for the wound healing. So both, depending on what you're trying to achieve.
Exactly.
Yeah, got it.
So I love what lasers have done for our world of dentistry. It's really opened up an amazing opportunity for our doctors, our hygienists, to use these tools in a way that can really get our patients finally, hopefully, into remission state, which is the goal.
Do you think that, I just watched the skincare movement taking home, light therapy in different forms for skin health, but also mental health. But I do wonder, home care applications for oral health and oral care, how many consumers would be really interested in that? Because I see a huge opportunity, but I'm not sure if the consumers see it that way yet.
Yeah, I think it's fascinating because if you can make it easy,
Yeah.
make it affordable, and you can show them the why behind it,
Right.
particularly if you test
Yeah.
prior to using.
Fair enough, yes.
And then you have them sent home with something like that.
Yeah.
And then they come back and you retest and you can show them that wonderful testing that they're used to getting in the medical community.
Sure.
I think that would be powerful for a lot of these patients who really don't want to lose their teeth.
Right.
And they're trying so hard to save them, but there's more to the story with them.
Right.
So I think with StellaLife, you mentioned skin. One of the things we've been working on is that we have a lot of off-label uses for our gel, and we hear stories all the time, and I have a few pictures I could show you that are fascinating outside the oral cavity what this gel can do. So when that started happening, we said, you know what, we need to really think about skin healing outside the oral cavity. So coming soon is a skin healing laser balm.
Oh, interesting.
And what we'll
Okay.
be doing with that product is it'll initially be designed to work in the arena of laser therapy on the skin.
Yeah.
So if a lot of our dental practices are shifting to medi-spas.
Yes.
They're adding that value into their practice.
Of course.
And we're going to be there to provide them with a balm that they can use that will decrease redness and accelerate the healing of the tissue after laser care on the skin.
Very nice.
The next step behind that will be that we'll look at really the more of the burns like that you might receive with oral
I was going to say
with
because
cancer,
you have the
chemo, radiation.
antimicrobial, so that
Absolutely. We're very passionate about our cancer care, and one of the very important things to StellaLife is we learned that so many of our patients who are going through chemo and radiation have just these tremendous side effects in the oral cavity.
Yeah.
Because of the pathogens already present, you're wiping out the immune system, you're traumatizing the body so severely to make them able to shrink their tumors and be able to live. Well, when we looked at this, we said, we've got to do better. Because right now the protocol is pretty much salt water and biotin rinse. And so what we wanted to do, again, going back to improving people's lives, is that we wanted to see how those patients could do with our StellaLife coconut rinse, which was developed really specifically towards that in our gel therapy together. And Dr. Mike Milligan, an incredible dentist that started AOSH a long time ago, very interested in oral systemic links. He himself, and he doesn't mind sharing that he went on a journey with cancer himself, and he wrote a protocol for patients that their oral care was so important during this time. So StellaLife was a part of his recovery. He said it kept him off a feeding tube. There's things that we need to think about with these patients that we could actually help prior to chemo and radiation and postoperatively. And the coconut rinse has more added ingredients to make it more soothing to the tissue. And remember, we're antimicrobial, bacteriostatic, keeping some of those commensals alone,
Right.
and really disrupting biofilm in a most important time for them.
Yeah.
So these are the things that we're interested in, and moving forward, we believe that our skin healing laser balm will also be a benefit for patients who go through radiation around the head and neck.
Brilliant.
So we're hopeful that as that product develops, we'll be able to demonstrate that as well. So
That's
exciting.
fantastic. Very exciting.
It really is. It's really fun to be a part of a innovation that we haven't seen in oral care in a while.
Right.
And
Yeah.
we've seen it in our tools like lasers and scanners, and today's world of taking an impression is like you don't need to anymore with scanners. It's
Right.
wonderful.
They're incredible. Yes, I
Incredible
agree.
benefit.
Yeah.
In prevention and oral care and post-op care for our patients, this is where we fill a niche, a need, and a real support system to our doctors and our patients.
Excellent. This is exciting. I'm really happy to kind of go through all the details because I underappreciated all of these factors. So thank you so much for walking us through.
Thank
I'm
you.
excited. Maybe we could find a way to collaborate. This is
Would love that.
exciting. So
We're always looking forward to the thought processes that go behind, let's look at this, let's look at that. And because we're an innovative company, we are open arms about understanding how we need to be collaborative and we need to work together to really fulfill our mission, which is, again, to improve people's lives and everyone's, not just our patients, but ours too.
yeah.
But thank you for
grow
having
the
me.
awareness. Yeah.
Yeah.
Could you tell our listeners where they can learn more about StellaLife and its product offerings?
So research tab under professionals tab on our website, StellaLife.com. It has a ton of information. Professionals tab will gear you towards our education and our research. It's all documented, deep dive into all of the research that's been done on the product. The products are there as well, so patients can find them that way. If their doctor does not provide it for them, they can come to our website so they can have access to it as well.
Excellent. Perfect.
Thank you so much.
Yeah, thank you guys for having me. Really appreciate that.
Will you be at AASH this year?
I personally will not be, but our team will be.
Excellent. Perfect. Fantastic. Thank you.
Let's get oral.